Viewers, I am Dr. M. SURENDRA NEHRU, MD physician. Today I want to talk to you about the HOMA clinic 90-day metabolic journey. In the world, first time as a physician I have developed using artificial intelligence a web app, complete app to control, reduce remission of obesity, diabetes and cardiac events, including hypertension and coronary artery disease. This app link I will be sending to you. It is available in my website www.homahealthcarecenter.in, or you can visit my YouTube HOMA SURENDRA NEHRU. My number is 0996 3721 999. Why I had to develop this web app is, in India and also especially in India, China and other countries, 65% of the money is lost by the patients in unknowing alternate useless model. When it comes to health and wealth, India and China and certain Asian countries, peculiarly the human brain and people, they act very peculiar in a monkey fashion. Except the important source, they will believe all the other sources. Unfortunately, in India, out of 150 crores, 100 crores, they earn less than 500 rupees per day. Less than $10 per day. There are 100 crores of people in India. These are the bottom of the pyramid. They never get the knowledge. And lower middle and upper middle also, real health knowledge is not deciphered or coming down to the public. This trickle down effect is one economic program given in Western countries, but somehow nothing trickles down in India and in Asian countries. The knowledge is super saturated for certain communities and certain individuals, high net worth individuals, highly educated software people, or few upper people only. They get super saturated, and rest of the 99% of the public, they get all wrong knowledge. And with the boom of the smartphones and networks and penetration of networks into semi-rural, semi-urban areas, alternative medicine, or some people, they just want to make money, or they want to get some TRP rating, or they just want some hype. They are destroying the health knowledge. In local languages and regional languages, and knowing the pulse of the public, using the algorithms of YouTube and other social media, they are creating mess in the healthcare. The problem is, once the human brain gets the wrong information, it will be in that loop. So the patients are losing time, energy and money. By the time they come to us, they are ending up in multi-organ failure. At least in olden days, they had directly only a government hospital where they can come to the doctor and take some advice. Now with capitalism and everybody wants to make money in an urgent, quick way, not only destroying wealth, they are destroying health. And every day we will be seeing advertisement from the government telling that be careful about wealth, don't give your bank account number details and all. But nobody is bothered more than money. Health, there are a lot of cheaters in the public. There are people without knowledge telling all wrong things to the public. And 99% of the YouTube and social media knowledge is dangerous knowledge. That is spreading fast. And as usually, no Indian likes to be responsible. But everybody wants to be authoritative. Maybe it has come from Britishers, we don't know. This mentality is still there in India. Except him, all the others should be slaves. This will never go, I think, in India. It's a DNA or culture. That is why I started a HOMA clinic 90-day metabolic remission journey, wherein I want to give at the tip of the hand what all that is possible, how to reduce your obesity, central obesity, and your diabetes and coronary events. Three peculiar things in India when compared to others are our upper and lower limbs are thin, so our BMI will be normal. Second is, when compared to others, India, China and Malaysians and Burma and Cambodia, Laos, Malaysia, all these countries, peculiarly our fat will be deposited around the abdomen called central obesity. This is where I am joining the dot with central obesity, measuring the waist circumference, forgetting about HbA1c and a BMI. These two, unless 90% of the pancreas is destroyed, your blood sugar will be normal, HbA1c is normal. So everybody thinks they are healthy. Blood sugar is normal, BMI is normal, cholesterol is normal. But they end up in ICU or kidney failure or with a brain stroke. This is because we don't know that our waist circumference for every Indian, now it has crossed 33 inches or 85 centimeters. Anybody who has crossed 85 centimeters from the age of 20 is at high risk for failure of beta cells, which is called diabetes. So this is a very beautiful program that I have developed. World's first program I am giving at the mobile with a lot of fundamental knowledge, which I will be upgrading, and with a good, beautiful diet, world's best beautiful diet, exercise program, everything including medicines and all. And most important, we are going to follow a focused approach, because there is a study where it has shown just by writing medicines and giving a diet sheet and sending the patient, the success rate of diabetes is only 0.25%. That is why I want to follow up the patient, give some value with the technology using the mobile, smartphones and artificial intelligence. We can reach the public, provided people are interested. People, if they come out of Siberia, we can help you. Everybody is designing their own Siberia. This is called Siberia walk. That is, you don't want to see the truth. You just want to be in hallucination, illusion, delusion, and going away whatever way you want. This is a peculiarity that is seen in India. So, comment on my video, join me in coming out of Siberia, and join Quit India Diabetes and Obesity. My name is Dr. M. Surendra NEHRU, Professor of Medicine, 0996 3721. I am using insulin test not only for diabetes but for central obesity, waist circumference, fatty liver and coronary events. Because sugar is normal, peculiarly our triglycerides will be high because of the rice and wheat eating country. From now onwards, I want to create a diabetes-free India and obesity-free India. Join me in my revolution of Quit India Obesity and Diabetes campaign. Thank you.